Hi, I'm Dr. O, and today we're here with Badger. And Badger's a 13-year-old roping horse that seems to be doing pretty good, but if you notice, Badger is in a lot of pain. His ears are pinned back. If we ask him to move, he's shy around the head. We come in here and we ask him to we give him a little bit in the girth area. He shows us he's shy. He's very, very jumpy no matter where we touch him. If we ask him to do a butt tuck, he immediately moves away. He's very, 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 very leery of us the whole way through. So, how are we going to fix this guy's pain? And we have to remember that pain is very important. That pain is important to the horse, but it's a different importance to the horse than it is to us. A horse will run, even though he hurts, to get away from the lion, because if he doesn't, he'll end up being lunch, and it doesn't matter how much pain he's in. So these guys will work through pain. They will move through pain, but remember that pain builds superhighways. And so as long as the pain is there, it keeps building more and more nerve pathways to reinforce the pain. And so we need to come in and help get rid of this pain. We can do several things with this guy. We should have him on some sort of a joint supplement, like the Acetyl M in his feed. Okay, this is going to help. The Acetyl M. This is going to help lubricate his joints. It's also got anti-inflammatory properties in there that's going to help break that inflammation cascade. It's going to help stop that inflammation cascade, because this guy not only has pain coming from some of his joints. I mean, obviously he's got some pain coming from his pole area. That's why he doesn't want us to mess with it. He has, if we look at his teeth real close, we notice that he has an overbite. Plus his jaw, bottom jaw, is offset. That means he's not able to chew right. Remember, his proprioception is incorrect. So that's going on. So he's got pain here. He's got pain here. He's got some problems in his neck, because if we ask him to move like he's supposed to, we ask him to go to a food treat, okay? It's not even worth it. Even though it's feeding time, he's not even going to start to go to the food treat. So we've established that he's got pain in the jaw, he's got pain in the pole, pain in the middle of his neck, okay? He's got pain right down here in his sternum area, which is probably an ulcer problem. Because he's got this pain, he's not breathing correctly. Because he can't breathe correctly, we know that his pH is off. His pH being off, okay, we know he's acidic. So he probably has some ulcers in his foregut. He probably has some ulcers in his hindgut. That's one of the reasons that he's sore in his back, okay? Not only is that, so we need to look at some things like we should put him on some Sornomor before we ride him, because we know he works. We can put the Sornomor underneath the saddle.
Dr. O, can I ask you a question really quick, because I'm in a really big hurry and I need to know right away, because I'm a little bit afraid of this horse.
Yes.
If I come up to this horse and I want to ride this horse and I'm breathing like this and I'm sitting still and I'm not moving and I forget to breathe, what kind of ride am I going to have?
You're not going to have a very good ride. So he's going to be...
Why?
Because
he's a
he
quiet
can't
horse.
breathe.
He's an old horse.
Because he can't breathe. He's real jumpy. We need to breathe deep, and we need to help him breathe deep. Because if we breathe deep and we're not relaxed...
If we're relaxed?
Then that will help him relax.
Oh.
And that's one thing where a lot of times where we have a hyper rider, like you were when you just came in, what I'll do is I will prescribe crises for the horse. When you're on the horse, you can't give his nose, you can't get his mouth, you really don't want to reach to his ears on him, because he's going to be really upset. So what you can do is put some on your fingers and rub it into his withers or his neck, and that's going to help calm him down. And as he calms down, that's going to help you calm down. Okay? So, but what we need to remember with this guy is pain management. And remember that pain that comes from anywhere, so in his gut, so we need to buffer his gut. We need to change his diet. We need to put him on a high protein, high fat diet. That's going to help his pain. It's going to help him move better. We need to keep him adjusted. We need to adjust him on a regular basis. You know, this guy might need to be adjusted every 2 weeks instead of once a month for a while until he starts to move better, until he starts to feel better. We need to use, you know, we may want to put a back on track blanket on him to increase his circulation to all of his joints. We might want to use Cetalamp. This is a candidate, a really good candidate for acupuncture treatment. Acupuncture is going to help with his pain level. We're going to put him on some sort of anti-inflammatory in his feed. We want to look at his teeth. Remember that his jaw was off and that he had an overjet and that his was off to one side, because all of this goes together. So when we're looking at a horse like this, it's a good worker. But he gives us some indications of pain, especially when we're just sitting here working on the ground, okay? The way he reacts to us. We take a guy like this, and if we can help manage his pain and help calm him down, okay, through a multifaceted approach. This is a horse that we're not going to be able to solve his problems with one adjustment. We're not going to be able to solve his problem with one acupuncture treatment or just using an anti-inflammatory in his food. If we want to really help harmonize this guy's health, we need to use a multifaceted approach, and that will make him be the horse that we want him to be.